It's time for another podcast by George. Straight talk, straight from the heartland, that'll have you saying, "By George, I think he's got it." Now, here's George.
Hello, hi, how are you? Welcome back in to another podcast by George. We've got the good doctor, and God, am I glad to have him back on. It's Dr. Andrew Nish, our medical expert that's been walking us through this now, the entire pandemic. He's been along for the ride on podcast by George, and kind of keeping us with our eye on the prize here, keeping our eye on the ball as we move through this. Things are changing, things are improving somewhat. And before we, I want to take a look at the CDC website, but let's welcome him in. Doctor, welcome back to a podcast by George.
Well, thanks, George. It's good to be here, and I'm finally back in Des Moines, so it's good to be home for a while.
That's great. Well, let me go ahead and bring this up on screen. Okay, so this is something I know you follow closely. This is the CDC COVID data tracker, and in marketing, they used to have a term that you would be headline blind, and I'm kind of that way too. I want to jump down to the details all the time, but I don't look at the things right at the top. But here we should. I look at this and I see cases in the United States, 30,038,363. My God. Then I go over here and look at this little chart that I'm highlighting, the cases in the U.S. last 30 days. That kind of surprises me, Doc. That it goes back to the podcast that we did just before this one. In the last month, these cases of infections, that's not as good as I thought it would be.
Yeah, and that's, if you listen to Rochelle Walensky, she's the director of the CDC. She has warned time and time again in the recent press that cases are going up, and they're stagnating and going up. And this is very concerning because not only are cases going up, but we have more of the variants circulating. So the UK variant is becoming more prevalent. It's more infectious. It may be more deadly. We're still learning about that. And, just because we have the vaccine does not mean we have to take the brakes off of our public health, put the brakes on our public health measures. When you look at your chart, only 15% of the population has been vaccinated with their second dose and has developed immunity. That means 85% have not been vaccinated with their second doses. So, you look at what states are doing. You look at what Iowa did. Okay, we're going to open up restaurants. We're going to open up gyms. You don't have to worry. You don't have to wear a mask. Well, that's why we're seeing an increase in cases. And we continue to need to, follow public health measures. And yes, we can, as the CDC says, if you have let's say you have 4 people in a household and you've all been vaccinated, you can get together. That's fine. It's getting warmer. We can get together outside with appropriate masking. So this is a gradual transition. This isn't, an on-off switch. Oh, we have a vaccine. Now we can do anything. No. Until we get the majority of the population fully vaccinated, we continue to have to do the things we've done for the past year. And if we don't, we're going to see another spike in cases. We're going to see another concomitant spike in deaths, and we're going to throw up our hands and wonder what happened. Well, I can tell you what happened.
Yeah, and those variants are key. And you talked about that again on the earlier podcast. Has anything changed on that? Because you mentioned this will all change if we see people that are immunized start to get infected again with the variants. Has that happened to your knowledge?
Haven't seen, that there's been that data out, nor has there been concern expressed, at least from what I read, that that's happening. The other part of this, new increase in viruses is every time the virus transmits, the more it transmits, the more it replicates, the more chance there is for another variant to come along. So if we want to stop if we want to stop the mutations, if we want to stop new variants from coming along, we have to stop the ability of the virus to replicate in transmission. And it's just, it's this self-perpetuating cycle. We so desperately want to do things the way we used to, no masks, interact. And we've still got a ways to go. And that's my message here today is do not stop doing what you've done. Continue to wear your mask, continue to physically distance if you're around people who have not been vaccinated. And when I say vaccinated, that's the whole group you're with, not just, oh, I was vaccinated, so it's okay for everybody else to be exposed. That's not really appropriate at this time. And, you referenced an article this morning about senior citizens who have been vaccinated and want to travel on airplanes and everything else. I would issue some restraint and caution on that right now. And if you're traveling, even though you're vaccinated, you have to wear a mask. You have to continue to practice what we've done.
Yeah, here's this article, and I got to tell folks now that the thing with the doc, I mean, he's great to come on the show. He's very busy. We don't do pre-shows, and I want to let people know when you're looking at cable TV and you're looking at mainstream media, those folks are all pre-interviewed. There's a pre-show that takes place, and so they all know what's going to come up, and they're all prepared to remark on it. But this is the one article that the doc is talking about. This is from the Associated Press by David Sharp, March 27th, in Dateline, Portland, Maine, and it's talking about these older Americans now. They're in that 15% that the doc was talking about. That's who's got the vaccinations. Well, they're wanting to go yippee, and they've been suffering with isolation issues, obviously, for the past year or so, even though there's ways around that to mitigate. But they're wanting to get out and travel, and they're particularly wanting to go see grandkids. They're wanting to get out and socialize again with their families, and they're doing that because they're not concerned about themselves becoming sickened because they're fully immunized. Well, okay, but the entire group should be in that category, because even since the pandemic first started, Doc, my understanding always was, even if you're willing to risk yourself before you were immunized, a major issue here has always been the fact that you could infect someone else, and mostly unknowingly.
Yeah, and that's true. And, we're still learning about, okay, so if you look at like a measles vaccine, that's a sterilization vaccine. That means you don't get the measles and you don't transmit the measles. The COVID-19 vaccine is not a sterilization vaccine. You can still harbor the COVID virus. We think you can probably still transmit low levels of the virus, probably not the number of viral particles if you weren't vaccinated. So we have to remember, it's not a sterilizing vaccine. And even though you've been vaccinated, yes, you are protected 95%, but there's the 5% who may get sick. Maybe you're transmitting some viral load. Again, that's, we're studying that. But it's not a get out of jail free card. We still have to be careful. I have my wife's parents are here in town. They've both been vaccinated. We're going to have an Easter celebration. We're doing it outside. We're physically distancing. We'll wear masks when we're not eating, all precautionary. Now, I think you give it 2 or 3 months, we're going to be talking very differently. If we're going to, Biden administration now says we're going to be able to deliver 200 million doses of the vaccine in the first 100 days of his administration. Vaccine availability is picking up. We'll be vaccinating more people. So I would expect in 2 or 3 months, the number of people fully vaccinated is going to increase significantly. But we're still not going to reach herd immunity by July. I mean, herd immunity is anywhere from 70 to 80% of the population has had a vaccine or is immune from exposure to the virus. We still have vaccine hesitancy, people who are concerned that the vaccine is untested, it's unproven, and they're not going to take it. We still have people saying they don't even believe the COVID exists, that it's a hoax. And so the next step is not going to be availability of the vaccine. It's going to be making sure that we're messaging that this vaccine is safe. And from a physician standpoint, when I talk to a patient, it's if they're hesitant about the vaccine, I can go over all the data I want. But what really is most important is you're getting this vaccine not only to protect you, but to protect your entire family. And when it becomes personal of protecting, who do you want to protect most? Your kids, your parents, that's who you're really protecting when you get a vaccination. So get your vaccination.
Well, here's another topic now, switching gears a little bit. And I know this is something the doc wants to talk about because this is right in his bailiwick. I mean, he is the mind connection guy. Now, I'm kind of the political guy. I look at that chart that we had up earlier and I look at those 500,000 deaths. And my God, why have we done so poorly? Well, politically, I would look at it and say Trump knew in February, according to Woodward's book, that this was that bad. He and his wife, I think his family, got immunized in January. Didn't tell anybody. If that guy had come out and told his followers who adore him, who literally will do anything he says, including following a dog whistle to overrun the U.S. Capitol, if he'd come out and told everyone to get immunized, to mask up, to hunker down, to self-quarantine, to do what was necessary, it would have made a huge difference in this. But the doc would say, and I know, this is just kind of handing it over to your world, Doc, that there are some other factors involved here with why we have done so poorly here in the United States, and it has to do with kind of our condition of our condition.
Yeah. It's very sad to me that we're in this situation. Not only, the political aspect of it, but I'm just going to kind of highlight some statistics. So if you look at the population of the United States, we're roughly 330 million people. That's 5% of the world's population. If you look at the number of deaths in this country, we're at almost 550,000. That's 20% of the world's deaths. So although we account for only 4 to 5% of the population, we account for 20% of the deaths in the world. Yeah. And to me, that's just an astoundingly startling statistic. We're supposed to have the best healthcare in the country. I would argue we don't, or in the world. I would argue we don't. So when you look at factors, okay, what's contributed to that? Why are we dying? And we don't have the highest death rate. So that's, number of deaths per 100,000. Mexico actually has the highest death rate in the world. It's about 9.1%. We're about 1.8%. But of, modern society, we're very high. Why is that? Why have we done so poorly? Number one, messaging through, politics. We didn't do the public health measures, but it really reflects more of how sick our society is. And we are a society of very sick people. And most people say, I always laugh. People come in and say, well, Doc, I've been told I'm healthy. And they've got a 45-inch waistline. I can tell you, you're not healthy. You're not healthy. Yeah. And so we have to look at, there's lots of correlates with this. And so one of the biggest correlates is if we look at obesity rates. So in this country, we have an obesity rate of just above 42%. We have another 30% who are overweight. That means 3/4 of our population is obese or overweight. That correlates highly with COVID infections and COVID mortality. There was just a study published in the Journal of the American Association, or the Journal of the American Cardiology Association. Mm-hmm. And what they found was that 2/3 of people hospitalized from COVID, those hospitalizations were attributed to 4 risk factors: obesity, diabetes, high blood pressure, and cardiovascular disease. And
which can be all related, right?
They're all interrelated. They're all interrelated, and they are associated with one another. And they're associated with our poor health habits. So when we look at the standard American diet, highly processed food, or food-like substances, as some of us like to call it, lack of physical movement, poor sleep habits, poor social interactions, all these different things are contributing to our extraordinarily poor health in this country. There's another startling statistic, and all of these diseases that I'm talking about start with what we call insulin resistance. And insulin resistance is our inability of our body to use insulin normally. And it's estimated that anywhere from 80 to 88% of people in this country have some form of insulin dysfunction. And that's causing all of these problems. So, we have to put a lens on ourselves and on our health in this country. And I think COVID is that lens. Why are we dying? Why do we have so many deaths? Why do we have so many cases? And it's obesity, its lack of activity. Another really interesting correlate are vitamin D levels. So there was an article just last week looking at vitamin D levels, and it was looking at the African American population. And when you look at the African American population, they have the lowest vitamin D levels of any ethnic group in this country. 90% of African Americans are vitamin D insufficient or deficient. And when you look at vitamin D levels, they correlate very highly with getting COVID or having serious consequences of COVID. So one of the things in the integrative medicine world is we're encouraging people to have their vitamin D levels checked and supplement with vitamin D, particularly when the sun isn't out. Now, we're entering spring. The best way to get vitamin D, go out and enjoy the sunshine for 45 minutes to an hour a day in shirt sleeves and expose your skin. But many of us are vitamin D deficient, and that may be a significant contributor to acquiring the virus and having severe consequences of the virus. We can go on and on about this, but we are an overweight society. We are a society that doesn't move. And we've depended completely on the vaccine to solve this problem. Just like we've done for decades, we completely depend on the pharmaceutical industry to solve our problems. The reality is most of these problems can be solved by ourselves with appropriate nutrition and movement and social interactions and sleep and feelings about yourself. We kind of all think we hate ourselves because we don't look as good as somebody, or we don't exercise as well, or we're not as rich. But we've got to give that up. We have to love ourselves. We have to be comfortable with ourselves. And when we're not, we're uncomfortable, we're not at ease with ourselves, and we get disease. So this is an enormous opportunity to reflect on our own health and make lasting changes so that when the next COVID comes along, which it will, we don't have 500,000 deaths. We don't have 30 million cases. And we can be a little bit more relaxed in society because we're not as worried about getting the disease. I mean, when you look at who gets this disease, it's people with all these pre-existing health conditions. And those are the people who are dying.
Yeah. And I've heard you say on this podcast before, and maybe more than most medical professionals, I've heard Fauci hint at it. The politicians don't talk about this much at all. But those socioeconomic factors that impact segments of our population so mightily that prevents them from getting the proper nutrition and the good food. They live in these food deserts, and they've got crap to eat, and it's hard for them to get good food, as an example. And that also affects their access to good health care, either through being able to afford insurance or just simply to have it accessible to them. And all of these factors, again, they're all interrelated, like we were talking about earlier.
Yeah, I mean, this reflects on our social net, to catch those who are socially not able to help support themselves. And it's got huge holes in it. When we look at food availability, and you talked about food deserts, that's defined as the inability to get fresh food within a mile of your residence. And so that doesn't seem like a big deal. Well, you can travel more than a mile, but you have to remember a lot of these people don't have cars. They depend on public transportation. It may not get them to where they need to go. So we have to, I participated in the Harkin on Wellness Symposium, and the theme for this year was food as medicine. And we talked a lot about these. How do we change systems? And it's not just the food system, it's the food distribution system, right? We can supply all the vegetables in the world, but if we can't get it to the appropriate place, then why are you even supplying vegetables? It's about food distribution. It's about helping people in poverty. Poverty is incredibly stressful. You're stressed because, number one, you're probably, at the lower end of the socioeconomic scale. You're stressed because you're worried about being able to pay your rent. You're stressed because you're worried about your own safety. You're stressed about worrying about where am I going to get food. So if you're under constant stress, guess what? You don't digest your food normally. You don't assimilate these nutrients normally. And so we have this distribution problem. We have this incredible stress that is on these folks who are socially, economically disadvantaged. We have this incredible stress on our own environment. We're, with trying to produce food by all these chemical inputs, we're destroying our soil. So our foods aren't as nutritious. Yeah. So this is all the whole. That's the whole of caring for one another. It's the whole for caring for our plants and animals. It's the whole for caring for the earth. And unless we change something, unless we change all these systems, we're in for a long road.
That's great. And that's the message. And it needs to be integrated from the top down, from the president of the United States all the way down to each and every one of us, folks. I mean, that's great, Doc. And we're running out. We're out of time, actually. But I did want to get to one other item here, medical, because I could talk lefty politics forever. But medically, you had mentioned, now this raised my eyebrows, that people need to kind of prepare themselves for vaccinations and what it means with variants, because this ain't over till it's over, and maybe it's never going to be over, but there is a possibility this is going to change.
So, yes, we're studying the variants, watching the variants really closely. I know that, the labs are now working on, okay, do we need booster vaccines to boost our immune system to help protect us from these variants? Right now, it seems that the vaccine is protective of most of these variants. But, we've been extraordinarily poor in this country at detecting variants because we don't do a lot of genetic sequencing, genome sequencing of the virus. Now, Rochelle Walensky at CDC has ramped that up immeasurably in the last couple months. So we are genetically sequencing more and more of these COVID strains. The best place in the world that was doing that was the United Kingdom. They were sequencing way more COVID strains than we ever did, but we're ramping up that capability. So we'll be able to study and track those variants better. And as we find out over time, are these variants, are vaccines protective? And again, we'll know that if people who have been fully vaccinated are getting COVID again, we've got a problem. And so we'll be studying this. Will we need booster shots in the future? How long is our immunity going to last? And will we need booster shots? Will it need to be an every year thing like the flu? These are questions that haven't been answered yet and are only going to be answered with time and study. So I would prepare people and say, this is not like a measles vaccine. It's not a sterilization vaccine. Get it once and you're done. I would be prepared to say that this may be like the flu vaccine, where every year we have to, address the variants and update your immune system. But that's okay. And maybe it turns out that one vaccine is enough for several years. This is all to be studied, and we have to be open to whatever happens and, not get disappointed. The biggest thing we can do is say, oh, I got my vaccine. Now they're telling me I need another one in 6 months. Well, prepare for that. Again, as I've talked about, it's all about expectation, isn't it, George?
Yeah, it is.
If we expect that we may have to get boosters, okay, big deal, I get a booster. But if the expectation is that this is a sterilization vaccine and I'll never have to do it again, that's an unrealistic expectation.
Well, we are out of time, and I got to close up shop here for this edition of Podcast by George. I got to tell you, Doc, I've done over 270 of these podcasts, and I don't interview anybody, and I have interviewed professional broadcasters and other podcasters and stuff. Nobody can put a bow on a podcast like you can. Your closing remarks are great. Give us a close here as we head out of this edition.
Oh, my closure doesn't change much, but you know what? This is, I'm sitting here in my office, I'm looking out at the beautiful sunshine, and I want to encourage people to safely get back together again in small groups outside. I think we miss that. And so even if you've been vaccinated, if you haven't been vaccinated, have 2 or 3 people over, sit out on your patio, enjoy the sunshine, mask up, be 6 feet apart, but go back and enjoy each other right now. This is, we're making progress. We're making great headway. And the other thing I want people to realize is, and I thought about this morning as I'm making my breakfast, how grateful every one of us should be right now that we actually have a vaccine. Because we could be in a situation right now where there is no vaccine. And I want you to be grateful and really understand how remarkable that this vaccine development was. So be grateful that we actually have maybe an end in sight, because it was entirely possible that there would be no end in sight even now. So give gratitude for the scientists who worked diligently to develop this vaccine, and give gratitude for all the workers that are out there trying to administer this, because this is a remarkable human achievement. And don't lose sight of that.
Man, that's well said. It can't be better said. Folks, that's Dr. Andrew Nish. Doc, thanks for coming on this edition of Podcast by George.
Always my pleasure. Great to be with you, George.
And folks, if you like him, if you like this, if you like Podcast by George, please subscribe to us on YouTube. Ring the notification bell so that you get future episodes, including those with Dr. Nish. And follow us on Facebook. All you got to do there is like us, and you'll be notified by the PBG. And, of course, we are available in audio. If you prefer to get those on your car or your iPhone, you can get it on iTunes and, the Google app and all kinds of places. But that's going to do it for now. That is going to wrap it up. That's all there is, and there ain't no more. That's another podcast by George.